Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Inquest. Inquest is defined as an enquiry into the cause of death, where the death is apparently unnatural. If you think the death is unnatural, then the inquiry that the police does, or it is called as inquest. Inquest can be of four types: police inquest, 2 magistrate inquest, 3 coroner's inquest, 4 medical examiner inquest. Police inquest and magistrate inquest are the only inquest which are conducted in India. Police inquest. Police inquest is conducted under section 174 CRPC. Police inquest is the most common type of inquest in India. Police inquest is conducted by a police officer not below the rank of head constable. That means it should be conducted at least by a head constable or above him. Procedure: the police officer who is in charge of a police station gets an information about the suspicious death. Once he receives the information, the police officer will inform the same to the nearest executive magistrate. From the executive magistrate, once he informs the executive magistrate, he proceeds to the scene of crime. This police officer who is going to the scene of crime is called investigating officer, IO. Now this investigating officer will conduct the inquiry at the site of a crime. He conducts inquiry at the site of crime in the presence of two or more respectable persons of that locality. These persons who give information to the police officer act as witness, and they are also called as panchas. Investigation officer prepares a report, and this report is also called as inquest report or panchanama. If the police officer or investigating officer suspects any foul play, then he will forward the dead body to the nearest authorized doctor for conducting postmortem. If he does not suspect any foul play, then he will hand over the body to the family.
Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about